Hi everyone, I'm Olivia and I'm here with Dr. Jared Teller from Art of Pain Management and Stem Cells Philadelphia.
Hi, how are you?
I'm wonderful. How are you today?
Doing great.
Great. Just wanted to know a little bit about Art of Pain Management and your transition over to Stem Cells Philadelphia.
Yeah, we started Art of Pain Management about 10 years ago. My partner and I, Dr. Michael Skina, we do predominantly interventional pain management, so spine work, knees, shoulders, hips, people with osteoarthritis. We work billing Medicare, Medicaid, Blue Cross Blue Shield, a lot of epidurals, nerve ablations, facet blocks, things like that. And over the years, we see people get better if they implement our full program. Weight loss, doing yoga, eating right, and dieting. But for certain people, there was no permanent cure. There was nothing that really put them out of pain. It was sort of people coming to our office once a month for medication and injections, and the process sort of kept repeating over and over again. A couple years back, we started going to some additional seminars and educational events where we started learning about stem cells and the different types of stem cells. We started implementing them in the office now about a year, and the results have just been phenomenal. People are actually getting better and decreasing their pain and having better qualities of life, and their normal activities of daily living are coming back, and they're enjoying life a lot better. It's a more rewarding type of medical practice that we have.
I've heard that there's two types of stem cells that you work with. Is there ones that are specific for certain people versus another kind for another patient?
There's many types of stem cells now. So when we first started doing it, there's bone marrow stem cells, where we aspirate or take a piece of the bone marrow from someone's hip.
Oh, wow.
It's very painful to go in and remove. We would spin the bone marrow and create the stem cell. And we weren't sure how many stem cells we would have. Then we would re-inject them back into the patient. There was always the uncertainty of the quality of the stem cells, right? So if someone was 70 years old, they have old stem cells. Mm-hmm. And as you get older, the number of stem cells decreases in your body. So when you're a baby, it's like 1 in 200,000 cells or stem cells. At 70 years old, it might be 1 in a million cells in your body or stem cells. So it's harder to harvest, and we were never sure of the amount of cells we would have and the quality of the cell because they were 70 years old. There's adipose tissue, which is fat, and you harvest those by doing liposuction, basically.
Okay.
The problem with that is the Food and Drug Administration, the FDA, sort of frowns upon manipulating the fat to generating the stem cell. It's a process called collagenase that you would have to do to the cell to create the stem cell, or do to the fat to create the stem cell. Mm-hmm. The collagenase process, the FDA says we're making drugs in our office, so they frown upon it. Plus, if you do get a fat-based, adipose-based stem cell, there are complications. They could clump. Mm-hmm. You never want to put them into an IV or through a vein. So there's definitely some negatives to that as well. The next one that we're dealing with is cord blood or amniotic fluid. Amniotic doesn't have a lot of stem cells, but there are a lot of good growth factors and cytokines and hormones that are positive to help healing. And cord blood does have an accurate amount of cells that we can count when we purchase cord blood from FDA-approved laboratories. The problem with cord blood we've seen over the years is it's really helped about 70% of the population get better, improve their lifestyles, improve their levels of pain, improve their symptoms. But there's that 20 to 30% of the population that wasn't getting better, and we couldn't really figure out why. And around that time, we started using exosomes.
So how often should someone come to your office and seek treatments for this?
So the protocols are set and simple. Joints, knees, hips, shoulders, ankles. It's 2 treatments, 4 weeks apart, 2 to 4 weeks apart. The treatments take about an hour. We would utilize the patient's own blood protein. It's called PRP, plasma enriched protein, with the exosome, sometimes with ozone therapy. It's injected in a joint, the spine, certain areas of the spine depending upon the condition, twice, sometimes 3 times, but usually only twice, 2 to 4 weeks apart. And that's all. Most patients do very well with that. We have almost a 90% success rate at this point in time, where the patient is getting, on average, 70% less pain and 70% less, 70% less symptoms. So if it's a multiple sclerosis patient or someone with Alzheimer's or someone with COPD, you're seeing
A significant difference.
significant improvements in those people.
That's wonderful.
Yes.
So can you elaborate on the types of injuries and patient issues stem cells test?
Yes, so we have great success with osteoarthritis, joint injuries, tendinitis, tendon injuries. People that are thinking about getting knee and hip replacements,
Could probably benefit from
they will ultimately, a good portion of that population be saved from not having a knee and hip replacement. We could help the patient to a point where a lot of patients do not need those risky procedures anymore and costly procedures anymore. We are dealing with some autoimmune things. Some patients see great benefit, COPD especially, multiple sclerosis. There's a lot of studies going on now in Panama and Germany and even in the United States on these things. Even cancers are being experimented with at this point. The reason why we switched over to using mostly exosomes is there's almost no side effects to the exosome, which is really an incredible situation. We harvest from an FDA-approved lab that ships it to us cryogenically frozen. So, and the concentrations are, we just found out actually this week that we're getting 1 billion exosomes per milliliter. And most of our treatments, we use 5 milliliters. So people are getting the equivalent of 5 billion exosomes, which is, exponentially more than any stem cells that we've ever used in the past. And patients are 1 or 2 failures, maybe 3 failures over the last year, have actually come back into our office.
And I've tried this.
To use the exosomes, and 2 of the 3, it's been successful. So in past where cord blood and bone marrow has failed, the exosome.
But it's given them that extra chance to come back in.
Has succeeded, yes.
Quality of life has changed. So how does one go about the process of coming into your office, calling, setting up an appointment? What's the span of time that you would see results?
So we do educational events through the city. We don't like selling anything. We really just want to educate the population on the benefits of utilizing stem cells, the pros, the cons. We talk about vitamins and minerals and diet and yoga and meditation. And,
that all helps.
Yeah,
but
and all of these other things that are out there. And most people that are interested in stem cells are health conscious or older population, probably like you, I think you mentioned earlier.
My grandmother,
your
yes,
right?
she would be very interested in this, just for quality of life assurance.
Exactly, and a lot of people with quality of life issues, just to want a little jump start, come in for little exosome IVs into the office, and they just feel better and younger,
right away.
energy and recovery times. So like if someone would play basketball, and recovery time would normally be 4 or 5 days, they seem to be recovering in about half as much time, maybe 2 days.
Awesome to get. I enjoy basketball, so I would really enjoy getting back out on the court.
Exactly. But yeah, you can just go to our website and stemcellsphiladelphia.com, or give the office a call, Art of Pain Management and Regenerative Medicine. We're offering free consultations by all the doctors in the office. Myself, Dr. Michael Skina, we have a physician's assistant as well, Lorna Carter, that's in the office. And I think we're maybe 2 to 3 weeks out right now.
How has stem cells been made affordable to everyone and not just celebrities and athletes and high-profile people?
So a lot of professional athletes now are doing stem cells. I mean, you can basically Google it. I mean, for years, people would have to go to Germany or Panama or Mexico
to seek treatment.
To seek the treatment. So 4 years ago, when I looked into getting my hip done, it was $35,000 to go to Berlin, Germany, to get a simple stem cell injection. Now in my office, I mean, a fraction of that cost to come into my office to get it done. No travel expenses, and we have it available to almost everyone at this point in time. So it has become affordable to even the middle class or people that truly don't want to get a hip replacement and want some regeneration of the tissue and get back on the court or get back on the field for the regular weekend warrior, for the regular person, not just professional athletes anymore.
How long until patients start seeing results?
So with cord blood and bone marrow, we were seeing results within 4 to 8 weeks. Now with the exosome, some patients are seeing immediate relief, immediate anti-inflammatory benefit. In the exosome, we have over 300 different anti-inflammatory benefits and growth factors and proteins that are attacking the body, let's say, right away, going right to your resident growth cells, right to your resident stem cells that are present in the body, recruiting them, and they're going to work right away. They're sort of resetting the body back to a day one baby's stem cell message. This type of exosome we're using in the office right now is harvested from a placental tissue. This placental tissue was ethically delivered and donated by the mother from a very healthy baby. It's been vetted for every disease process known to man and every genetic modification known to man as well. So we know it's a perfect sample. So when the lab we utilize harvests this, we know it's a perfect day one regenerative exosome that's going to reset our own body back to that message.
Original state.
Yeah, back to that original state.
Dr. Teller, can you tell me a little bit about, does insurance cover this at all? Is there any financial plan that could be set up for the patient?
So unfortunately, most insurance plans are not accepting this treatment yet. There is some possibility with some workman's compensation plans, which we're applying for now, starting to accept this treatment because it's saving them a lot of money in unnecessary surgeries. We do have payment plans available in our office. There's financing options. I mean, I've seen some as low as $100 a month to get these procedures done.
And it's well worth it, since they're walking out of there happy patients.
Yes, it's been well worth it. It's a very satisfying way to practice pain management and healthcare again in our office. It was frustrating for a while playing sick medicine. Now we're able to do well medicine and help the patients in the future and currently.
Speaking of the future, what does stem cell therapy look like advancing forward?
So the technology is ever advancing. I've read some studies recently that they're going to customize exosomes for the exact problem you're having. So they're working with it now in China and India, and some American PhDs.
So what I would use for my shoulder wouldn't work necessarily for my hip?
Right now we're using general exosomes, which work for the whole body, but they're actually developing ones that would be for a ligament, or for cartilage, or for lung tissue, or for cancer. So they're actually going to be developing this messenger.
So very specific.
From stem cells for very specific in the future. It's getting more advanced.
It's truly remarkable what you're doing for all of the patients out there and the future of medicine. I just want to thank you again for being here with us today and answering all of our questions about stem cell research. Can you just tell us again where we can locate any of this information?
Yes, stemcellsphiladelphia.com is our website, and on the site we'll have all of our educational events and all of the opportunities to have a free consultation with one of the doctors. So thank you so much for having us.
No, thank you, Dr. Teller. Again, that's stemcellsphiladelphia.com.